When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed-sponsored jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
This is Dr. Ted O'Connell with the Med Prep to Go Step 2 Qbank podcast. Today we'll be reviewing 3 renal questions. Just a reminder that you can find these questions and many more at medprep2go.com. If you have feedback or you'd like to get involved in this project, please reach out to me at ted.medprep2go@gmail.com. If you like what we're doing, please let your friends know or consider leaving us a review. All right, let's go ahead and get started with the first question. A 54-year-old man presents to the outpatient clinic for management of his blood pressure. He reports feeling well and does not have any complaints. Medical history is significant for hypertension and stage 4 chronic kidney disease with proteinuria that has been quantified at greater than 3.5 grams per day. The patient states he is compliant with his current medications, which are lisinopril and nifedipine. He reports eating a heart-healthy diet. He is afebrile with a blood pressure of 152 over 90 millimeters of mercury, heart rate of 78 beats per minute, respirations of 18 per minute, and a body mass index, BMI, of 29 kilograms per square meter. Physical examination shows jugular venous distension of over 4 centimeters above the sternal angle. Cardiac examination reveals an S4 that occurs during late diastole. Lungs are clear to auscultation without wheezing or crackles. There is 1+ bilateral pitting edema in the lower extremities. The remainder of the examination is otherwise unremarkable. Laboratory studies reveal the following: sodium, 137 milliequivalents per liter, potassium, 5.1 milliequivalents per liter, chloride, 94 milliequivalents per liter, bicarbonate, 22 milliequivalents per liter, blood urea nitrogen, 21 milligrams per deciliter, creatinine, 2.6 milligrams per deciliter, estimated glomerular filtration rate, or GFR, is 25, glucose, 124 milligrams per deciliter, and calcium, 8.2 milligrams per deciliter. Which of the following is the most appropriate additional medical therapy according to the current American College of Cardiology and American Heart Association, the ACC/AHA, blood pressure guidelines? A, candesartan, B, chlorthalidone, C, furosemide, D, hydralazine, E, metoprolol succinate. The correct answer is C, furosemide. This patient has an elevated blood pressure, not controlled to a target goal of less than 130 over 80 millimeters of mercury, according to the ACC/AHA guidelines. A loop diuretic such as furosemide is indicated for treating hypertension in patients with advanced chronic kidney disease, as seen with this patient, who also has clinical findings of increased extracellular fluid volume. Loop diuretics are preferred in patients with chronic kidney disease and a GFR less than 30. Answer choice A, candesartan, is incorrect. This patient already takes lisinopril, and combination therapy with an ACE inhibitor and angiotensin receptor blocker may result in adverse events, such as acute kidney injury and hyperkalemia. Answer choice B, chlorthalidone, is incorrect. A thiazide diuretic will unlikely be effective in patients with stage 4 or stage 5 chronic kidney disease, and this patient's estimated GFR is less than 30 milliliters per minute. Answer choice D, hydralazine, is incorrect. Hydralazine will lower the blood pressure but not address the patient's fluid overload status. Answer choice E, metoprolol succinate, is incorrect. Without indications such as coronary artery disease or congestive heart failure, the addition of a beta blocker is not appropriate. The key learning point here: loop diuretics are second-line therapy for hypertension, but are preferred in patients with chronic kidney disease and a GFR less than 30, as thiazides are less effective in these cases. Loop diuretics are also indicated in severe heart failure. Question 2. A 67-year-old woman presents to the physician's office for a health maintenance visit and is noted to have an elevated blood pressure reading. The patient is doing well and is without symptoms or complaints. She has a history of achalasia, which was successfully treated with a Heller myotomy with partial fundoplication, and she also has osteoporosis. She is currently being treated with a yearly intravenous infusion of zoledronic acid and also takes a daily calcium and vitamin D supplement. The patient is a retired registered nurse and states that in the past 6 months, 2 blood pressure measurements done in the healthcare setting averaged above 150 over 90 millimeters of mercury. However, during that same time period, blood pressure measurements obtained at home averaged less than 130 over 80 millimeters of mercury. She has no other pertinent personal, social, or family history. She is afebrile with a blood pressure of 150 over 92 millimeters of mercury, heart rate of 70 beats per minute, respirations of 14 per minute, and oxygen saturation of 98% on room air. Body mass index, or BMI, is 19 kilograms per square meter. The physical examination, including ophthalmic examination, is normal. Which of the following is the most appropriate management for this patient? A, begin hydrochlorothiazide. B, collect 24-hour urine metanephrines and catecholamines. C, obtain a basic metabolic panel and start lisinopril. D, order magnetic resonance angiography, MRA, of the renal arteries. Or E, perform ambulatory blood pressure monitoring. The correct answer is E, perform ambulatory blood pressure monitoring. This patient has a story consistent with white coat hypertension, which refers to elevated blood pressure measured in the office with normal out-of-office measurements. This patient might have elevated blood pressures, according to the ACC-AHA, the American College of Cardiology and the American Heart Association blood pressure guidelines. Therefore, it is essential to evaluate for hypertension using ambulatory blood pressure monitoring, or ABPM. ABPM works by taking blood pressure readings continually over a 24-hour period. The patient wears a device that collects information throughout a 24-hour period that will later be transferred to a computer. The main difference between ABPM and home blood pressure monitoring, or HBPM, is that ABPM assesses daytime and nighttime blood pressure during routine daily activities, typically during a single 24-hour period, whereas HBPM assesses blood pressure at specific times during the day and night over a longer period of time while the patient is seated and resting. In patients with established white coat hypertension, annual follow-up with out-of-office blood pressure measurements should be considered to determine if conversion to sustained hypertension has occurred. Answer choice A, begin hydrochlorothiazide, is incorrect. Starting medications such as a thiazide diuretic is indicated once a diagnosis of hypertension is established based on the results of the ABPM. Answer choice B, collect 24-hour urine metanephrines and catecholamines, is incorrect. This is the correct workup if pheochromocytoma is suspected. However, the patient does not have symptoms related to excess catecholamine secretion, such as sustained or paroxysmal hypertension, headaches, palpitations, or diaphoresis. Answer choice C, obtain a basic metabolic panel and start lisinopril, is incorrect. Obtaining a basic metabolic panel and starting an angiotensin converting enzyme, or ACE, inhibitor may be indicated once a diagnosis of hypertension is established based on the results of the ABPM. Answer choice D, order magnetic resonance angiography, MRA, of the renal arteries, is incorrect. This patient has no indication for renal artery imaging, such as concern for renal artery stenosis or fibromuscular dysplasia. The key learning point here: a diagnosis of white coat hypertension can be evaluated using ambulatory blood pressure monitoring, which takes blood pressure readings continuously over a 24-hour period and can establish whether a patient has hypertension or not.
In Walmart's Newville, time was ticking away. Only a few nights left till the big holiday. But last-minute gifters had no need to worry. Walmart Express Delivery got their gifts in a hurry. From Nintendo to Nespresso and Lego flowers, they could check off their lists in as fast as an hour. All of Newville, East, West, South, and North, could order gifts up until 5 p.m. on December 24th. So this holiday, just do as the Who's do. With gift delivery this fast, they all gasped. From Walmart? Who knew? Subject to availability, terms and fees apply.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, our holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Question 3. A 65-year-old man presents to his primary care physician with complaints of progressive bilateral shoulder pain over the last 2 months. He denies any known trauma. He has a history of end-stage renal disease secondary to type 2 diabetes mellitus, and he also has hypertension and secondary hyperparathyroidism. He receives hemodialysis 3 times per week. Medications include lisinopril, chlorthalidone, insulin, atorvastatin, calcitriol, and sevelamer. Vital signs are within normal limits. Physical examination is consistent with scapulohumeral arthritis, and shoulder x-rays are consistent with this. Which of the following is most likely to be present if biopsy of this patient's rotator cuff were performed? A, amyloid A fibrils, B, amyloid light chain fibrils, C, beta 2 microglobulin fibrils, D, diffuse calcifications, or E, transthyretin amyloid fibrils. The correct answer is C, beta 2 microglobulin fibrils. Patients with end-stage renal disease, or ESRD, who are on dialysis have decreased clearance and subsequent accumulation of beta 2 microglobulin. The most common clinical manifestations of beta 2 microglobulin amyloidosis are osteoarticular complaints, including scapulohumeral arthritis and rotator cuff infiltration. Destructive spondyloarthropathy, typically manifesting as neck pain, and carpal tunnel syndrome may also occur. Answer choice A, amyloid A fibrils, is incorrect. Amyloid A is an acute phase reactant that accumulates in secondary amyloidosis, which occurs due to chronic inflammation. Clinical manifestations are similar to those of primary amyloidosis, with renal involvement being most common and cardiomyopathy being less common. Answer choice B, amyloid light chain fibrils, is incorrect. Amyloid light chain fibrils accumulate in primary amyloidosis, which can occur in patients with plasma cell dyscrasias such as multiple myeloma. Excessive immunoglobulin light chain production results in nephropathy with heavy proteinuria, hepatosplenomegaly, cardiomyopathy, and carpal tunnel syndrome. Answer choice D, diffuse calcifications, is incorrect. Diffuse calcifications may be found in calcific tendinopathy. Although calcific tendinopathy develops gradually and is unrelated to trauma, shoulder x-rays would likely reveal calcified deposits. Beta-2 microglobulin amyloidosis is more likely in this patient with ESRD. Answer choice E, transthyretin amyloid fibrils, is incorrect. Transthyretin, also known as prealbumin, accumulates in age-related amyloidosis. Common clinical manifestations include neuropathy, cardiomyopathy, and carpal tunnel syndrome. Unlike other forms of amyloidosis, renal involvement is rare. The key learning point here: amyloidosis secondary to end-stage renal disease is characterized by deposits of beta-2 microglobulin, which can present with arthropathy. Other types of amyloidosis include AA amyloidosis, which is secondary to chronic inflammation, AL amyloidosis, which is secondary to plasma cell dyscrasias, and ATTR amyloidosis, which is typically age-related. Okay, that's the end of this episode, but please do check out our other episodes as well as all of our other content available online at medprep2go.com.
This episode is brought to you by Marqeta. When it comes to your payments provider, you can't afford to compromise. Marqeta's modern payment solutions flex with your business without the trade-offs. Stable and agile, secure and innovative, scalable and configurable. If they say you can't have it all, don't believe them. Your business demands more. Choose a payments provider that delivers more. Choose Marqeta. Visit marqeta.com/Spotify to learn more.